All right. Hey, everybody. Welcome to our new home for our briefings as the rest of the complex is turned over to the front lines totally with vaccinations and testing. So, certainly not what we thought we would utilize this space for in 2020 and 21, but it's working out well for us. Let's go through some numbers here. Unfortunately, we lost 4 individuals over the last 24 hours. Two in the hospital, two from nursing home facilities, 96-year-old female and a 90-year-old male. I just want to think about them and their family and let them know we're thinking about them and they're in our thoughts and prayers. Positivity rate holding true, 5.4%, 7-day average. It's been there for about 3-4 days, which is a good sign overall for where we're going. We absorbed the holidays and the New Year's punch, and now hopefully we'll continue to move in the right direction moving forward. Hospitalizations 190. That's up 2 since yesterday, down 40 since last Tuesday. And we have 4 residents waiting to go to the COVID transitional unit, and we have 35 residents who are in the ICU. Overall, we now have had 27,038 positive cases of COVID-19. That's up 256 on the day. So I think yesterday we were around 213. Today, 256. Good numbers. Going into the end of the week is when we usually see where we stand week over week. As traditionally that's when most of the testing comes back, the way that the national labs come back in, and so we'll see how we do tomorrow and then towards the end of the week. Again, reminders: symptomatic testing, the FSHED Monday through Friday 9 to 2, ongov.net/Cayuga Medical. Weekend testing at Nescentia Health. Again, ongov.net/Cayuga Medical for an appointment. On the weekends, 8 a.m. to noon. Asymptomatic testing, you can go and register for the on-center every day. Tomorrow we will be at the Fayetteville Senior Center and the Moyers Corner Fire Department. On Thursday we will be at Onondaga Town Hall, and Friday we will be at the Lafayette Town Center for community testing sites. Part of our strategy was to go out, actively test everywhere we could to try to identify the virus and pockets of the virus with intention. We think that's really helped us as we've gotten through these peaks and valleys of the holiday season, and hopefully we'll continue to go downwards as we continue to hunt for all these small pockets. Vaccine, let's go over this. We have done at the Onondaga County Pod, which is the War Memorial and now the On Center, we have vaccinated 11,773 first doses. Today, which is the last day of a vaccination week, because today is Tuesday, our vaccination weeks are Wednesday to Wednesday, we will vaccinate another 1,170 people with first doses. The challenge being that we received 900 doses today for the next Wednesday to Wednesday period. So we will not have a clinic on Wednesday tomorrow. We will have a clinic on Thursday. We will open up registrations tomorrow. We will, every time we get more supply in, we tell the state that we try to focus in on and help get certain segments of 1B done. So we will work and hold some of those slots for teachers, law enforcement, and other government employees, but then we will open up other slots as well. Again, 211 has been our way of trying to level the playing field for our seniors who aren't tech savvy. They can call 211. We give 211 slots that you can call and they can help register. But again, it looks like next week, as far as first doses go, we're going to have 900 new appointments. Every once in a while, these are Moderna doses. So Moderna, like Pfizer, sometimes you can get more out of a vial, and if so, we'll do more appointments, but not much more. This is frustrating. This is very frustrating. Our pod is the fastest pod in the community. We've been the most efficient. We've been recognized by the governor as being the most efficient. So for us to be sidelined for a week, essentially, there's no better word than frustrating. We will begin second doses next week. You'll get an email from us, and then you'll get an email with a link for a time to get your appointment scheduled. So next Monday and Tuesday, we will be giving second doses to those that need them. So we'll still be having a clinic, but those will be second doses. So overall, a couple clarification points. Right now in our community, you can go, if you're 65 and above, go to the pharmacies. The pharmacies have set up appointments for weeks in advance, right? So if you today were looking for a vaccination appointment, the pharmacies probably aren't a quick solution. The fairgrounds, the state sets up the fairgrounds site. We help staff that in a partnership with the state. They set up a calendar, I believe, till April. So slots are all booked till April. So if you're looking for a new appointment at the fairgrounds, it's probably not likely you're going to get one. So the only new appointments really were us, and because we do it every 3 days. So I understand the frustration for those who are trying to get a new appointment. But we do need to recognize that this week we will have over 10,000 new residents getting vaccinated with their first shot. If you have an appointment, you keep your appointment. These are just new appointments in the community that are being limited with the supply issue. Second doses, you need to go back to where you got your first dose. Every person that we vaccinate, we have a second dose already waiting for you, essentially 4 weeks later if it's Moderna, 3 weeks if it's Pfizer. You cannot come to our pod and then go to the fairgrounds. I got an email saying I got my first shot in Florida. Where do I get my second shot? Your answer is Florida. So these are the things that we need to understand. With every person vaccinated at that pod, there is a second dose for you that goes to that pod for you 3-4 weeks, depending on what the vaccine is. So please make sure if you went to Cayuga County and the Cayuga BOCES, and that's where you got your first dose, that's where you got to go get your second dose. If you went to the War Memorial for your first dose, now you come here to the On Center for your second dose. You can't mix and match between sites. That's not how this works. So we can take more questions on vaccine. Case investigations, again, a reminder, if you get a number 833-634-1564, that is us texting you, asking you to fill out part of the investigations via text online. This helps streamline everything and helps us get your case to contact tracers so that process can start. So again, thank you for your cooperation in advance. And then just one other topic right now that I know is one that people have been reaching out. It's an important week for schools related to sports, if there's going to be fall or spring seasons. We need to let these kids play. And the reality is we know a lot about schools. We test in schools. We know from the fall protocols that we can do this. And so we're certainly encouraging our state partners to work with us to figure out a way to let these kids have sports seasons. The numbers are going in the right direction. We're vaccinating more. As we vaccinate more, we see the progress in our senior facility numbers, and we'll continue to see progress with first responders. And so it's time to let these kids play and let them have a season and get back to some sort of normal with their school year. Saying that, happy to take questions.
As far as demographics go, what kind are being kept and when will they be made available about who's getting the vaccine?
As far as
Demographics, I mean, because when you say
Yeah, at some point, I haven't gotten that data, right? So at some point, the health department will look at that. What's being looked at more and tracked at the state level is what classification of 1A are you? What percentage of healthcare workers have gotten the vaccine? Then, as soon as that gets to the point of probably exhaustion, right? Whether that's 70, 80, 85, 90. What percentage of teachers and educators, what percentage of law enforcement officers? That's what's being tracked right now. I couldn't really tell you how many people from Manlius or Syracuse or anything there yet. At some point, we'll get there.
What are
Uh,
demographics on race and gender and things like that?
Dr. Gupta may have some of that. I don't have any of that information. Again, right now, our goal has been not so much the analytics on it, but just getting shots in arms as fast as we can. Now that things have slowed down this week, we might have more time to look at some of those analytics so far.
Ryan, the governor gave the impression that vaccines are being doled out on a per capita basis, roughly. At least that was my understanding. Why was our allotment cut so severely this week? The state didn't have a 75% reduction in doses that were available. Why was ours cut that much?
Yeah, so part of the challenge is the way that these appointments were scheduled at the fairgrounds and the pharmacies. So if you're going to schedule appointments out 2 months in advance and then you get less vaccine, the easy answer for you instead of canceling appointments is to give less vaccine to the person who hasn't scheduled them to begin with. So that we were the easy choice. Even if we did schedule out vaccinations for 2 or 3 weeks, we would have got canceled anyways. That's what happened in Erie County. They scheduled out based off of getting 7,500 a week. They got 1,700. So they were canceling quite a few vaccines. We're in a better spot that we didn't schedule these, so we aren't essentially canceling. That's a horrible thing. This is an emotional process at the vaccination sites, and people kind of can let down a little bit when they go through this, especially with their second shots. So the last thing we want to do is be in a position where we're canceling that. We know how stressful it is for people to get the appointments. So that's why I think it was the easy call for the state. Do I like it? No. And do I feel like what's happened, the way this has happened, you're keeping your leading scorer on the bench, to use a sports analogy? Sure. But it is what it is this week. It might be the same boat next week. The only difference next week is at least we'll be giving out second shots, for the full week. This week, it looks like we'll be doing we'll have a small clinic on Thursday, and then if there's any redirected vaccine, we can take it. One thing I did ask the governor, his team for, is he referenced yesterday the long-term care facilities. At these facilities, it looks like there has been many of the employees have not gotten vaccinated, and it doesn't look like they're going to get anywhere close to 100% participation. So they're working to have the pharmacies reallocate some of that supply to the state. I have asked for some of that supply to come to us for our region. Again, we have the ability to do 18,000 vaccinations a week. We are doing 900 this week.
Well, your understanding is that because, like the fairgrounds and other clinics scheduled out into April, that they're now holding doses?
Yeah, they're holding the doses for this week. And I would have made the same decision if that's what I was faced with. If you look at, you get cut, who do you have to cut? Instead of cutting 3,000 appointments over here and then making 3,000 new ones over here, you cut the person who hasn't made them yet. I would have made that same decision. I don't like that. It's just, that is what it is. I think moving forward, though, I'm following all these plans, and we've been doing this for a little while. Mass vaccinations is something counties have done for over 100 years. We've been looking at the plans. We're encouraged by the urgency of the incoming president and his administration. But one thing we don't need that I see, at least in our community, we don't need more points of distribution. We need to utilize our infrastructure, the fairgrounds infrastructure. The fairgrounds can do 18,000 a week themselves as well. And then your next distribution point should be Shopping Town Mall. And then after you do that and you quickly vaccinate, and why do you do that? We do it quicker than pharmacies. We do 1,400 a day if we have that here easily in our sleep. A pharmacy can't do that. A doctor's office can't do that. So if your goal is time, that's what it has to be now. This is our ability to fight back and punch back. We need to be at the sites that can do this quickly. We need to be the ones getting us through this log jam of people that are all eligible. And then after that, you micro-target. You go into areas that haven't participated, to your point with analytics. You micro-target those communities with pocket sites. And at the same time, always working on equity, making sure that you're not leaving your seniors behind, communities of color behind. So I've been watching a lot about this. The challenge is the supply. The last thing we need is bringing on 100 new distribution points when we haven't even exercised the capacity at our 2 mega sites in the community.
What is your diagnosis on what the actual problem is? The governor and his team says it's the federal government. Do you agree that the supply problem is rooted in the planning out of Washington?
I do. I think the communication out of Washington is abysmal, right? Horrible. I think we get ahead of ourselves a little bit overall when you take a step back, because we didn't expect to maybe even have a vaccine at this point. So when you just got approvals in December, now we're mid-January. I think it was mid-December they got the approvals, right? I forgot. Maybe it was in November or mid-December. To come up with the doses as quick as what we all want them to, probably not as feasible. But there's one thing I saw Secretary Azar say, the president-elect's 100 million doses in 100 days is selling the system short, right? He said we can do 250 million. Okay. So why don't you, if we can do that, and you know that because you've been running this operation, how many is each state going to get each week moving forward? Tell them now so that they can plan accordingly and we can get these shots in arms. They didn't do that. So I don't know who to believe. I do believe that the state of New York got less doses this week than they got last week.
Pfizer was December 11th, by the way, so you were right with December. But then based on that point, this isn't a problem then. It's just where we are. If this infrastructure didn't know a vaccine would be here this soon, it's just the unfortunate reality that it's out now. They've opened it up to so many people. There's just not enough. It's no one person to blame. Is that what you're saying?
It could be. I think the communication is driven this. There's been a leadership gap out of Washington for at least the last 30 days on this issue. And look at everybody in Washington, this should be the sole focus, is to get us through this pandemic, because nothing else matters till we are. We can't truly rebound with an economy and deal with the many other issues this country is facing until we can get through this and people are comfortable to live their lives again. So that's what everybody needs to focus in on. And I think if we all do that, we'll be better for it. But if by April there can be 250 million doses, which is probably 125 plus 125 equals 250, right? Two shots. That will be significant. And if that's true, communicate it now so everybody can plan accordingly.
Now that teachers are beginning to get vaccinated in 1B, is there any plan on a date to bring students back to school 5 days a week?
Yeah, I think that's a great question. Certainly, once you have your workforces vaccinated, what does the state education department do about the rules they've made? Right now, one of the challenges is with the hybrid models is the 6 feet, the distance draws to smaller classrooms, which means you can't have as many people. So does that go away? You just have mask mandates. You keep the testing protocols, and can you do it that way? I think people will have to take a look at that. But I think the key to your point is getting the adults vaccinated. We know the adults certainly when the adults get this virus, they have worse outcomes than the young people almost every time. So, and we know that through the testing, the existing protocols work. So how do you balance all that? But the state education department and local districts should certainly look at that.
Would you? Is there any number on the amount of people in the county that are eligible for the vaccine right now?
We're over 100,000 people. Yeah, yeah. So again, tough to tell how many. I know out of my 11,773 going into today, some of those are not county residents. They're Central New York residents, and I know there's county residents going into some of our smaller counties to get vaccinated as well. So overall, we're making progress. Each week, more people are getting first doses, and it's not hundreds, it's thousands. It's not as fast as we want it, and we've built up this distribution network and this infrastructure to really, really crush this thing. We haven't been able to utilize it yet, but when the key thing is when we do get the supply, we do utilize it, because those are unforced errors then at that point. And that's when, Andrew, you'll hear me speak more forcefully if we're not utilizing the infrastructure when the supply's here.
At that point of utilizing dosages, has there been any instances of any kind of waste with the vaccine thus far that you know about?
Not in Onondaga County. We have not wasted a dose, and we won't.
Have you run into any good issues, where you have one dose left, nobody signed up, but there might be a county employee who can benefit from it?
Yep.
Could you speak to any of those instances?
Yeah, so each day, at the end of the day, if a vial is opened up and then there's still a dose or 2 doses left in a vial, we do not discard that. We go and find a human being. So you'll find the different, the state gave us directions and directives. If this happens, your public-facing employees, go vaccinate them. That has happened. And then there's at times, I know when doctors became part of 1B, and there was things at the end of the day, reaching out to those offices and seeing if they can be down in 5-10 minutes. Things like that have happened. We will not waste a dose of vaccine. And even if it will never happen. It wouldn't have happened even when the rules were tighter.
Would you speak to what you've already hit on, the infrastructure you've built, how many doses you can do in this building, how many doses you need to get to duplicate the operation at Shoppingtown, and yeah.
Yeah, so we can do 18,000 weekly doses in this building. So that could mean you can do 18,000 first shots, and then you have another site doing 18,000 second shots, or it can mean you're doing 9 and 9. I believe the fairgrounds easily could do 18,000. Shoppingtown probably, even though it's very large, it's probably, you probably can't do quite as many because of the logistics of the layout. But if you're looking at a third large distribution point, Shoppingtown's very good, because then you have the west, you have the central, and then you have the east set up. And so that is how this thing should build out. Once you get more vaccine, getting it in the hands of doctors' offices to potentially deal specifically with the immunocompromised individuals, who better knows those people than their doctors, right? And so these are the things that I think will happen. And as frustrating as all this is, because we want to do more and we're excited about the opportunity to vaccinate, and this happens to us, this isn't really the state's fault. It's just the reality. The communication has been horrible. We can blame that on the federal government, with how they're communicating to the states and then how it flows to us. But where we all should be under the microscope is when the supply does come in, and when we have the supply, how do we execute, and who's getting the vaccine to get it into arms, because it's a race, it's a sprint.
What do you consider into that 18,000? Is that parking, space, staffing, storage of the product, all of those things?
Yeah, and you really look at your vaccinators. So how many vaccinators do you need? Between 35 and 45 to do that at each location. So from there, they have scribes that work with them in teams, and you have other employees as well. But certainly, with the parking we have across the street and in the garage, we have ample parking. The logistics of the room The room's big enough. We have the vaccinators. These are all people that we already employ, so there's no real new cost to us. They're just doing, vaccinating instead of what they used to do.
Brian, you mentioned the importance of high school sports. Do you have any insight into what the state's timetable is as far as when that might happen?
Yeah, hopefully. I don't. I know there's a big movement right now. I know that today, part of a little bit of a slower day is Dr. Goop just talked to me about what's happened with the opioid epidemic in our community, and things are bad. This will probably be the worst. 2020 will probably be the worst year we've ever had. But nobody was even focused in on it. Part of that's directly related to lockdowns and them not getting services. So it goes to mental health with our kids, right? And so if you look at this, a lot of these kids have had to sacrifice a lot anyways. So if we can do this safely, which I think we can, we got to figure out a way. We owe it to the kids. So, the adults got to figure out a way to make this happen.
Is there an avenue for you to push it forward on the state's priority list?
Yeah. I've been bringing it up in my conversations with the control rooms and when I speak to the governor's senior team, which I do. We have great communication with the governor's team, and I'll bring this up, and I know that other county executives are doing it as well.
When you do you expect, or when they return, are there any restrictions or like mask mandates that you would expect to be kind of put on kids?
I'm not sure. I think depending on the sport, and many of the collegiate athletics or professional athletics in these spaces have their own best practices and CDC guidance. So I would assume that whatever sports season, if they were allowed to proceed, would match those types of regulations and guidance.
I'm sorry if I missed this in a previous briefing. Why did you move from the War Memorial to the On Center?
The Syracuse Crunch hockey team is going to be playing a shortened season, so they needed the ice back. So we gave them the ice back and moved over. We were moving over anyways when capacity reached, to get to 18,000. We couldn't do that in the War Memorial. We needed the On Center, so we just moved over earlier.
Two budget-related things. We heard from the governor today, his budget address. We hear some stimulus in the works from incoming President Biden. Do either of those solve any big problems or make problems worse over the many conversations we've had about the budget crisis in Onondaga
Yeah,
County?
well, stimulus would solve a lot of problems. So we would be able to essentially pay back ourselves for some lost revenue. We would be able to solidify our workforce, and then we would be able to do exactly what it sounds like, a stimulus. We would look at certain local projects that we could invest in with those funds to stimulate the economy. So we're certainly following very closely. I was on a call with my peers around the country and the President-elect's Economic Council last week, where they got to hear from us and hear about our challenges, and that often when there is a stimulus, if it doesn't go right to local governments, it doesn't flow to local governments. And so if the intention is to get it on the ground, to get the money to Main Street, the best way to do that is to use your local governments. And I wasn't the only county executive saying that. There's dozens from very prominent communities across the country agreeing.
And lost revenue would be one gap to be filled?
That was something very much that when you look at Cook County in Illinois, or you look at Harris County in Texas, or in New Orleans, where you have a city mayor, but she also runs a parish, which is a county form of government, similar to New York City. Lost revenue is something that we didn't just lose it for 2020. That growth went like this, and so even if it curves up that way, it was going all the way here. So there was a big gap of lost revenue. Doubtful the federal government's going to make up all of that, but if they could address the 2020 lost revenue, that at least puts us on firm grounding so we can do some different things.
But was that a possibility from them?
I think it is, yeah. I think it is.
I know you said that the county will receive 900 doses, but do you know how many doses the other vaccination sites will receive, like the fairgrounds?
I believe the fairgrounds, I could find. I believe they're around 7,000 this week, between 7 and 8,000, uh, and the pharmacies. I think Kinney Drugs got 1,600 again, and then there's about 4 or 5 other pharmacies. I think Tops and a couple Wegmans, and I think there's a little pharmacy in Marcellus that gets some doses too. So they all got the same allotment they got last week.
And what's your message to residents who are seeing that there is a shortage, but they're racing to sign up?
Well, there's not many opportunities to sign up at this point, right? I don't think they have the appointments open at these other sites right now. We just got to be patient, and we're going to get through it all, and everybody's going to get vaccinated. And what they shouldn't, here's the good news about all this. There'll be this week, 10,000 more people will get vaccinated in our county than there were last week. And then moving forward, hopefully the supply gets better and we can increase that number. So each week we're making progress. I understand the anxiety, and I understand people have really been kind of very scared, locked away in their homes for a period of time now through this latest surge. And I understand that this is how we, get our revenge and our vengeance on this virus. It's just going to take a little bit longer right now, but we'll get there.
Ryan, you mentioned the opioid epidemic. Are you seeing a lot of that even among high school age?
Yeah, I haven't gotten the demographics on that. I think it's just a point about mental health in the community. The other public health crises we have because of COVID-19 that isn't directly related to the virus infecting you is real. And that's the decisions by public leaders can exacerbate those parts of the problem, right? So we need, I think what's different at this end of the process is we know a lot more. We've lived through this. We've seen it. We know how to plan for it and react to it better. So some of the decisions that were made early on may have been necessary. Maybe they weren't necessary. History will judge. But the fact that we figured out a way to grind out the surges we experienced over the holidays without massive disruptions to the economy was important, because many of the other public health impacts we're seeing are directly related to the lockdowns that happened earlier in this year. So I think overall, even though we had more cases, we knew how to handle them better. We were more prepared for them. We didn't get overrun. And now we're starting to see the cases drop off. And that certainly helps a lot of the other public health issues we've been seeing with mental health, suicide, opioid and drug abuse.
Brian, when the vaccine supply does pick up again, are you ready to have like pop-up clinics go out to housing authority complexes or other hard to reach areas where
Yeah. So what we want to do is exactly that, Tim. We've talked to the Syracuse Housing Authority. As soon as we have some supply, we would love to go and do pop-up clinics there. A pop-up clinic isn't just showing up and putting shots in arms. You got to do there's an education component to it. Certainly some independent living facilities as well, where these are seniors who your independent living facility is independent. So these seniors can register for appointments, but it's harder for these seniors to get to them, right? So those are areas that we would very much like to put together teams similar to what we did with testing teams and go to the residents there to make sure, again, our seniors and then specific communities of color are receiving equity in this process. Again, at some point when we do the data analytics, when we look through and we vaccinated 100,000 people, and you try to figure out geographically and based off of race, what are you seeing? Is there glaring trends? Then you got to go back into those communities and micro-target the vaccination process.
When you add week to week the totals of vaccines given across the county, whether it's the county distribution, the state distribution, or the private pharmacy distributions, is it week to week the same, or is there a dip?
Oh, this week will be less than last week for sure.
Significantly though, or
Yeah, I think you'll probably see a 4,000 drop off because of the disruptions, right? And because we were getting 3,600 doses, Andrew, but we were getting redirected vaccine. So we were at least getting redirected another 1,000, 1,500 that we were getting into arms quickly, whether it was from the hospitals or not. The hospitals didn't get anything this week. So last week they got 3,500. So when you look at that, we took a hit, they took a hit, the fairgrounds took a hit. Everybody felt this.
but you took the biggest hit because you didn't have those appointments booked
Correct.
in the future.
Correct.
So then, you're a Republican. You didn't take a side in the presidential election. I'm wondering how much you're looking forward to tomorrow and a new president.
Yeah, I'm hopeful. I wish the incoming president a lot of success. If he's very successful, we'll do well as a country and as a county. And I appreciate the focus in on the pandemic. I think the outgoing administration dropped the ball completely from getting what could have been one of the most historic accomplishments in modern American history with getting a vaccine, and then just after the election, everything just fell apart. So it really is disappointing and disheartening. So it's a fresh slate tomorrow, and I wish President-elect Biden, who will be President Biden tomorrow, all the success. He knows Onondaga County. He went to school here, but not only did he go to school here, he lived in a neighborhood here. He lived in my neighborhood, in the Strathmore neighborhood. So at the same time, there was many McMahons that lived in that neighborhood. So little did they know that the future president would be living on Stannard Ave. So there's a lot of ties to Central New York. I think that would play well for us.
Just to clarify, you said the hospitals aren't getting any doses?
Not this week. Second doses, but not first doses. Which, from a distribution standpoint, isn't we get it out faster than they do. Anyways, not saying that they get it out slow, but they got the initial wave of vaccine because they have the employees that need to be vaccinated first.
Does it worry you that much of supply isn't being used by nursing homes, that many workers are saying no thank you?
Yeah, for the residents, the participation has been a lot better, which is it needs to be. So that's good. But I think for the again, getting an education component for some of these long-term care facility workers, as time goes on more, hopefully they'll come and get vaccinated. I think we'll get through, once there's more supply, we'll get through a wave, and then there's going to be people, we've seen it in law enforcement communities, haven't been racing to the vaccination door here either. There's going to be different segments of the population that we need to go have conversations with and inform them so that they can reassess their decisions. But at the end of the day, it's everybody's decision.
Ryan, with high school sports, what data kind of makes you confident that now is an appropriate time?
Yeah, so each day we do testing in schools. So remember the way these are set up. If you're symptomatic, you're not supposed to be in the building. So how do you know there's not hidden pockets of the virus in the buildings? Well, we're testing. So we're testing in these buildings, every day, different buildings. So we have a boatload of asymptomatic testing data since school came back from Christmas break. And it's well under 1%, the positivity rate, right? The community positivity rate has dropped, almost been cut in half, close to it, over the last 3 weeks. So we're in a better spot as a community, but we know specifically in the schools, it's well below the community rate. So, I put those numbers out almost every night when we do it during the week. So I think the data really helps drive this. And the data says schools are safe, even when we have elevated positivity rates in the community compared to where they were when the school year started. Other questions? All right, folks, we'll see everybody on Thursday.